Good afternoon, everyone. My name is DJ Wells, and you've joined us once again for our weekly conversation, Coping with COVID, where each week we talk about those things that are heavy on our minds as we wrestle with this pandemic. And certainly things have been going back and forth lately. We've had new surges in the infection rates, and so this topic is more important than ever. Um, Also, in these past few weeks, we've had several states begin to talk about what next year is going to look like, and specifically as it relates to education. Folks have been making governors and schools have been making announcements about their plans for beginning the next school year and trying to resume normal education operations in spite of or in light of the COVID-19 pandemic that is still with us. And so today, we just wanted to talk about that a little bit. We as we were promoting this particular event, we reached out to many of you. We sent out invitations and we asked folks to send questions in advance. We asked folks to let us know what they were thinking about and what questions they had. And many of you did just that. And so we're going to spend today chatting with Dr. Mensah and getting some of those questions that were already sent in answered. But we certainly encourage you, if you've got additional questions, if you did not get a chance to send your questions in, or if any of the conversation that we're having today sparks some new ideas, please do ask those questions. Let's make this an interactive event, and certainly send us your questions. There's a Q&A tab. If you're watching on a PC, it should be at the bottom of your screen. Click on Q&A, type in your question, and as the broadcast goes on, we'll get a chance to work those questions in. We don't have a guest today, so it's just going to be Dr. Mensah and I answering, or Dr. Mensah and I'm not going to say that we're going to be answering those questions. Dr. Mensah is going to be answering those questions. I'm just going to be asking them. But let's have that conversation, and we encourage you to participate as well. And so, Dr. Mensah, great to see you as always. Welcome.
Mr. Wells, thank you very much. And to all of our colleagues out there and folks we work with so well, welcome to another segment. And hopefully we'll be able to provide some decent answers and guidance. I know there's a whole lot of angst and confusion about it, and right now, as a parent who has at least one more child going through the school system, we are indeed concerned about how this whole process is moving and evolving. So that's why we're doing this piece today. We had some very concerned people who were asking us, what can we do? And we said, you know what, let's address that in a format where everyone can have an opportunity to sort of hear similar questions and perhaps have some thoughts about it.
Very good, very good. And we've gotten some very good questions. So I'm looking forward to hearing your thoughts on some of these questions. And let's jump right into it. And it's funny because, obviously we talked about this being an event that discusses the school process, and certainly all of these questions relate to school, but some of them kind of harken back to some of our previous conversations just about immunity and preparedness to fight off the COVID-19 virus as it is. One of our regular viewers sent us a note asking, they say that recent data show that there are certain blood types that actually may be more at risk for contracting COVID-19 and having a more severe outcome. Is there anything that those children of ours that might have that more at-risk blood type should be doing differently to prevent catching the virus, or trying to overcome it if they do catch it, since these kids are going to be probably exposed to higher levels of COVID infection opportunities once they get in school?
Absolutely. First of all, we're talking about the blood type A. And, for some reason, blood type A individuals, not just in terms of physical health, but oftentimes in recovery of cognitive disorders, may actually progress a little bit slower. Now, what does a little bit slower mean? Now, it doesn't necessarily mean that you're talking about weeks or months. We may be talking about something as little as a 24-hour period. That is something still that's miserable, but we're not talking about huge numbers here in terms of time. One of the things that we do have to be concerned about is that, as long as everyone is taking appropriate precautions to boost their immune system, to optimize their immune health, and to decrease inflammatory processes, within their system, they're in a fairly decent place for statistical improvement and survivability. Okay. The one thing that I'm most cautious about are the children who've got special challenges, whether it may be reactive airway disease, many people would call that asthma, or some type of chronic condition, whatever it may be in a child. That puts them in a different risk category, and we'll talk more about that during the course of our discussion today. But overall, the blood type scenario, it doesn't mean that, oh, if you have this blood type, you're going to die. No, that's not what they're saying at all. They're simply saying that there's a bit more challenge in terms of time delay or time lag for recovery.
Well, actually, let's jump right into that comment that you were starting to make, Dr. Mensah, because that was one of the other questions that came in regarding those other conditions that might be of greater concern. There are several parents that were asking, my kid has asthma, my kid has autism, my kid has any one of a number of conditions. Are there any game changers out there? Are there any conditions that, say you as a parent would say, my kid has this, I'm not putting them out there at risk. I'm not going to send them into a school system where their chance for infection might be higher?
Okay. This is where things can get a little bit dicey.
Mm-hmm.
There's a double-edged sword to the whole protective child thing. We know our children miss the social aspects of school. Many have been suffering for a long time, and unlike adults, they don't have the real capacity to understand what's going on and why. Now, I'm talking about the younger kids. I'm not talking about your fifth, sixth, seventh, eighth graders and high school folks. Our children with special needs, the children in the autism spectrum, they are indeed more vulnerable. Okay, there's chemical dysregulation all over the place. We know our children with autism tend to be low in zinc. We've talked repeatedly about the strategic necessity for appropriate levels of zinc in the system to support immune function, to give our white blood cells and all of our macrophages and all these other cells that fight to protect us their optimum capacity. Zinc is necessary. We see in children who are in the spectrum that more often than not, they are deficient in zinc. And so the first thing that we see here is, well, we're asking, should we send our kids to school? Well, we have to provide the best optimum scenario for everyone involved. Many parents have got to go to work, right? So now people are slowly getting back into the work environment. If you're a parent that doesn't really have much alternative, we don't know what we can do, except do our best to help produce as much biochemical support for your child as possible, weeks out before they go back to school. The other consideration is, and we'll talk about this more globally, is testing. Okay, 3 weeks out before school begins, get your child tested. Okay, plain and simple. If they're going to be going back into that environment, get tested, find out what the situation is, antibodies or no antibodies here in the United States. That's what we have really readily available. There's so many issues and questions around this concept of children going back to school versus being at home. If you can keep your child at home and your child has special needs or special circumstances, then if possible, I would say certainly to do so. But the other side of the equation is that children, they start to have behavioral challenges when they're out of routine. So we've heard from parents already in the last several months, my child is freaking out. They're used to going to applied behavioral analysis, also known as ABA therapy. They're used to seeing their speech person, their occupational therapy person. And we know children who are autistic are very regimented, very strategic individuals who are in need of consistency. And when they fall out of routine, then they have a very difficult time, a very difficult challenge, just maintaining their normal behavior state. And so they're more irascible, they're more angry, they're more irritable, they're more behaviorally out of normalcy. And it is a hard thing for parents to deal with. We've had this question several times just in conversation at our clinic. We've had people calling in saying, hey, you know what, this is going on. My child is out of routine and it's really messing with them. We don't know what to do. Okay. So, I mean, there are a lot of layers to this issue, but it always goes back to supporting your child as best as you can. And then we've got to look at social dynamics after that. Okay. One of the things that we will talk about is that some of these special needs individuals, let's talk about children who have asthma or reactive airway disease or things along those lines, for example. Some studies suggest that these children are no more likely to be hospitalized than individuals who don't have asthma or reactive airway disease. Now, there's a cautionary piece here because many people start to generalize these kinds of results, okay? Special cases. Every child who has reactive airway disease is different. They are not uniformly the same. Just like we say when treating autism, if you've seen one case of autism, you've seen one case of autism because of the unique nature of the child. Same for reactive airway disease. Many children do the inappropriate thing because many parents are not aware that, certain foods may actually trigger reactive airways. Certain types of foods, whether it be dairy, whether it may be gluten, or a variety of other things, that can create problems. And so if these children are continually exposed, they're going to be more sensitive. They're going to be more reactive. One of the great things about kids, as we've talked about in terms of our treatment of COVID, is children tend to be extremely high in melatonin. And melatonin is a very powerful anti-inflammatory, antioxidant agent that children just naturally have a whole lot more of than adults do. So when children are born, for example, let's just say their levels are up here. By the time they're in their 40s or 50s, it's way down here. You can't even see it below the screen, okay? So somewhere around age 24, 25, you see melatonin levels down here. And then by the time they're in their 40s, well, we don't sleep as well as we used to. But babies, oh, look at this. This is beautiful. Babies, on the other hand, have such high, sky-high levels of melatonin. They're naturally protected against a lot of agents that would come to try to infect them or destroy them biochemically. And so not only do they sleep well, they're being protected very well because they don't have antibodies until they're about 6 months of age. So their own natural immune cells are not up and kicking. So nature provided a wonderful chemical in their systems to fight against inflammation and oxidative stress. So that's why, for the most part, children tend to do better. But it doesn't mean that they go away unscathed. There's a syndrome that we've been seeing where it kind of bears a disorder called Kawasaki's disease. And Kawasaki's disease shows the little white spots called hand, foot, and mouth disease. And a lot of doctors are looking to see why all these rashes are appearing and so forth and such in children when they're supposed to be better immune, able to handle the COVID virus. Well, it's not something new. We've talked about the fact that COVID is actually a vascular virus. It is not a respiratory virus. It is a vascular virus that, again, attacks red blood cells, hemoglobin, iron, and that which ties it all together, vitamin C, or ascorbic acid. So when you've got the ascorbic acid out of the system, which is what COVID does, it kind of destroys vitamin C's capacity to get involved in all this joining. You now push iron out of the system, away from hemoglobin. And if you don't have hemoglobin and iron binding and wrapped around by the vitamin C, so to speak, what happens is that you can't bind oxygen. You cannot attach oxygen to the hemoglobin molecule, and then you starve. You starve of oxygen in a sea of oxygen. Okay. So what COVID does is it breaks apart all that wonderful capacity. It separates all the binding that goes on in order to allow people to be able to survive and to thrive with regard to oxygenation. So why are we talking about all this? Because when we're talking about asthma and reactive airway disease, okay, there is the spasming of blood vessels, there's inflammation, not just of the vasculature, but of cytokines, and it makes everything much more difficult to move oxygen through the lung system and to remove carbon dioxide, okay? So when we're talking about these things, what we're really referencing is the entire picture here. So children with reactive airway disease, yes, hospitalization is one thing, illness is a whole nother scenario. It doesn't mean they don't get sick. So we still want to protect them as much as possible. And so we need to be very careful about the choices we make relative to this scenario. I know I've given like a 30-minute answer on just a very simple question, just the first one, but we'll talk about that, okay?
Very good. Now, speaking of protection, we've gotten several questions as it relates to masks, which is certainly one of the forms of protection that we've debated in this country. And quite frankly, I don't quite understand the debate, but don't mean to pontificate or be political here. But the fact that masks have become kind of a political landmine in this whole conversation about how we recover from COVID is an interesting phenomenon. And certainly several of the school districts, several of the states that have talked about their plans for reopening schools have done so while also, in essence, saying children are probably going to be required to wear masks while they're at school. And so we've had some folks that have asked some questions about masks. One of our viewers has sent in a note saying, can you speak on the effectiveness of a face mask in preventing the spread of coronavirus? Some folks are saying that it's more of a peace of mind thing rather than a true inhibitor of spreading or contracting the virus, while others say that it's not about stopping the spread, it's more about giving people peace of mind. There's discussions about, those people that are more immune compromised, perhaps needing masks, but healthier people maybe being optional in terms of their mask wearing. What do you have to say, Dr. Mensah, about the mask as a form of protection and whether or not our kids should be wearing masks when they go back to school?
Okay, I think what we have to really understand here is that children are Trojan horses. They carry everything, and parents, there's no parent out there who's been paying attention to their children in the last whatever number of years they've had them, who does not know that if a child goes to school, they're going to come back home sick at some point in time, and everyone in the house is going to have it, right? As a matter of fact, an interesting anecdote, we had a mom call us, and we were following up on how their child with autism was doing. And she said, well, you know what, interesting, as far as being sick is concerned, that kid brought home something. All of us got sick, but the kid wasn't sick. So we're talking about two siblings and two parents that all had colds, while this one, who probably brought it home, was actually just doing everything normally, enjoying life, living life, la vida loca, but everyone else is miserable. Children are reservoirs of carriage, okay? So first of all, when we're talking about masks, we're talking about simple, believe it or not, micromolecular physics. If you have a barrier here, and this is where stuff comes out, people don't realize air molecules have respiratory droplets. There is moisture, there is water vapor, there's a lot of stuff that comes out of the mouth, not just bacteria and viruses, okay? So if you have some form of a barrier, you may not get everything, but it's like a tightly knit mesh. You're going to catch a lot. So you minimize the amount or the concentration of viral particles that come out of your system to get to somebody else. My partner, Dr. Bowman, is always talking about viral load capacity and viral loads. So many people are sensitive not just to one viral particle. It's about what kind of dosing you're getting for that viral particle. Somebody says, well, what does it take to get drunk, right? And somebody else says, oh, listen, I can drink 12 beers and never get affected. But, Jonas over there, he drinks, one beer and he's done. If we make that as analogous to viral particles, the more viral particles you get, the more likely you are to get sick. Okay, the fewer viral particles you get, the less likely you are to get sick. Your body's immune system, and there's not a set number. Okay, everybody's immune system is different and has different capacities. So someone else, one person's immune system may wear a giant S. Okay, and you know what? Lightning can come from the sky; they don't get infected by it. Okay, whereas somebody else is a lot more susceptible, and so just a few particles may run rampant in their system because they're already immune compromised. Many people don't know they're immune compromised. What does immune compromised actually mean? Okay, it means your immune system doesn't function, not even exactly suboptimally. It may not function optimally at all, but it means you're more likely to be susceptible to some type of illness consistently as compared to the general population. But if you don't come in contact with a sickness or an illness, how do you know you're not immune compromised? How do you know that those 3 or 4 weeks where you've been working hard late at night in the office and not getting any sleep, eating bad food, hasn't worn down your immune system? Everyone out there knows or should know that you could wear yourself out. That's why we rest. When we rest, we are rejuvenating our systems so that we can fight the good fight at all times. But many people can put themselves into that state, and others are just sitting there because their immune systems are just not what they should be in general. We don't want to play that game of Russian roulette right now. So wearing a barrier of some type, in the worst case scenario, it decreases viral load. This is not about someone's peace of mind. It's about pure physics, okay? Put a mask on and see if you can eat, okay, without removing the mask. You can't get those giant particles through there. Now, you might be able to get some gases, something through there, but that's not sustenance for the body. But that's because those are really, really small particles. Okay, a barrier forms protection, mostly for other people from you. Okay, so what you've got may not bother you, but it could bother somebody else, and that's been the subject of a tremendous amount of discussion. Now, what about our kids? So our kids go to school, they come across other kids, and they're all breathing and they're doing whatever have you, and they're wearing masks, but even with masks, there's still a huge viral load out there, right? So we just have to be very cautious and do the best that we can. It is far more appropriate for our children to be wearing masks in school than playing that game of Russian roulette. Simply not a good idea.
Well, let's stay on this topic of masks a little bit, because there are also some questions that expressed health about questions that expressed concern about the mental health of our children as it relates to wearing masks. Is this something that, you talked before about routine and the like, is this new routine of wearing a mask, is that going to impact kids in a negative way from a mental health capacity?
I think there's always some challenge with regard to change. Mommy and daddy, why do I have to wear this? It's hot. Mommy and daddy, why do I have to wear this? It's weird. But children are also really bright people. If you talk to them and give them the understanding that this is something that's new in the system that we have to do in order to protect ourselves and to protect other people, not just ourselves, but other people, and that, talking really loudly without one of these things on and sneezing and all the other stuff that we do could make someone else sick, you'd be surprised how well they listen and they understand it. I've been, as I go to the grocery stores, it's been very interesting. while it's not normal, we're seeing family members, a mom or a dad bringing in 2 or 3 kids of different ages, one in a stroller, and they've got a little tiny baby mask on. Okay. And each of the kids has got their little mask, and they're not complaining, they're not fussing, they're not, doing anything out of the ordinary. They see mom and dad wearing the masks and say, hey, this is what we have to do right now to be kind of grown up in a different world, in a different system for the moment. As long as they've got parental reinforcement, understanding, and explanation, I think children are highly adaptable and highly pliable. Okay, but do listen. If they're saying, "Hey, listen, mom, I'm having a tough time, breathing," then give them an opportunity just to lower that for a minute, catch their breath, and then bring the mask back up.
What about the education process itself when we're talking about masks? Do you think that kids will be able to learn effectively when their teachers are wearing masks? So those kids are not able to get those the same level of nonverbal cues, for example, from their teachers. Are there concerns about behavior acting out? We talked about behavior disorders earlier, or just acting out and changes in behavior. Will kids feel that they can get away with a little bit more if either they're behind a mask or if their teachers are behind the mask?
This is a great question, and I'm not sure I've got the full answer on that one. But I'll tell you that since these conversations began with parents, we've talked to quite a few school teachers and educators, and I can tell you folks, look, the educational system is not thrilled with the new mandates that are out there. Principals, teachers, there are folks who are even retiring at this point in time because of all these new changes that are in play. It's not an easy conversion for anyone. It's not an easy transition for anyone, parent, teacher, child. It is not. And some things are really to be determined. I think that with some of these changes, my initial thought would be that many children actually may be a little bit more hesitant to misbehave if they're within full capacities here of control, because they can already see there's sort of a boundary around their capacities to be mischievous, right? How many kids are sticking out their tongue or making faces at other kids, whatever have you? You can't do that with one of those masks on, right? So then the only other thing is, getting caught misbehaving means a greater physical effort that could be noticed by the teacher, okay? We don't know what this is gonna look like yet. Only time is going to tell once we get into the school year and see what happens institution by institution, okay? Most institutions, are sitting there with a great deal of regimentation around sitting, standing, and when one can move around. But other institutions, such as many of the Montessori schools, are kind of rooted in a child's greater freedom and greater capacity. So what type of institution or system you're part of is going to have sort of a different rule, regulation, and manifestation of the effects of wearing masks, on the kids. And I think that is really still to be determined.
I've got one more mask question that was sent in. And by the way, I'm mentioning the questions that were sent in as I had noted at the beginning of our broadcast today. Several of these questions were sent to us in the week leading up to today. And so we've already got a good cadre of questions that are fueling our conversation. But certainly we encourage you, if you have any further questions, if any of the things that we're talking about today spark new questions, or if you didn't get a chance to send your questions to us, please do remember there's still opportunity to participate in this conversation. Use the Q&A tab at the bottom of your screen and type in your questions. We'll make sure that we feed them to Dr. Mensah at some point before we finish up today. But the last mask question that we have here speaks to the physical health concerns around young children wearing masks. Things like breathing in one's own carbon dioxide. Is this concern heightened with children who might have some of those respiratory problems that you were talking about before, or children who have autism or other conditions? And are there other health concerns above and beyond that increased CO2 load?
The answer is yes.
Okay.
Um, I brought this up myself as a question because look, let's be real. It's hard to wear, depending on the type of mask you're wearing. It can be very difficult to breathe in and out wearing that mask, or let alone to speak for extended periods of time. Okay, we do this out of necessity, not out of comfort and peace of mind. The issue is what is functionally challenging. So maybe you have a lighter cloth medium or a lighter fabric medium that allows a little bit of greater breathing density with a little bit of better capacity to dispel carbon dioxide. But otherwise, over time, yes, it can be a little bit of a challenge. And so we talk about the potential for maybe lightheadedness or dizziness. And if children need to understand if that's happening, then you need to lower that just for a little bit, for a quick moment, so you can catch your breath again, and then put the mask back on. Okay, so it's one of those situations where we're not talking about critical life or death mechanisms here. We're simply talking about really functional discomfort. And children with reactive airway disease, that's really not so much an issue. Okay, as long as they've got their meds with them and they know when to take a real breath and when not to. So that one is not as much of concern or consideration, as one would think it is.
You've mentioned a couple of times here, and this is a follow-up question that I just came up with based on our conversation. But you've mentioned a lot of times, just in the last couple of minutes, teaching the kid when it's okay to lower the mask and bring it back up again. Sounds to me like you're saying, and I think I would agree with this. We need to be teaching our kids about mask etiquette. We need to be teaching our kids what it is that they need to do to keep themselves safe while they're out there in this new germy world that we're existing in now.
Well, yes, we can call it masking. Okay, what is proper masking etiquette? You heard it out here first, folks.
Right.
Okay, it, absolutely. The children have to be told, listen, if this gets really, really, really too hard for you, then here's how you do it. Okay, here's how you lower it so that you can take a regular breath and then put it back up and make sure you pinch it around your nose here. This is not a mask. Okay, nasal droplets can come out as well. Okay, this is coverage. This is not. This is so that you can take a breath. Okay, when you're done, put it back up here. And that's only at the point where you're not able to continue the regular breathing with full mask on for a minute. Okay, and I don't mean 60 seconds. Don't take me literally. I mean more for like a few seconds. So education from parents about how to do this. And look, if you don't know, then contact your doctor, contact your facilities, your medical facilities, contact your medical friends or family members, your nurses, all those folks. This is what we'd be talking about in terms of making sure you're able to just maintain some regular semblance of comfortability as well. Because if you're not comfortable, you're not going to learn too terribly well. Okay, so these are the considerations that we would have about wearing a mask and teaching your children about what is proper masking etiquette.
Very good, very good. We just had a question come in from a teacher, and it's funny because good timing here, because we had a couple of other questions that teachers and administrators have sent to us. And so I was going to get to those questions next, but this question kind of provides us with a nice transition. It's still talking a little bit about masks, but also talks about it from a teacher's perspective. And our viewer asks, if students are all wearing their masks, could the teacher perhaps not wear a mask, or instead wear a clear face guard so that the students can see the teacher's full face, especially for students with learning differences? This allows for the kids to pick up on those nonverbal cues that a teacher might be giving with their facial expressions while still providing some level of protection. What are your thoughts on that?
Well, that's a great question. Okay. First of all, I don't agree with the teacher not wearing a mask, not at all. And the reason for that is that if the students are sitting down, let's just think purely about physics and gravity, okay? When you speak and respiratory droplets are coming out of your mouth, they can float in the air, but eventually they come down to the ground to settle. Your students are sitting at ground level while you are standing and speaking, which means that if you're not wearing a mask, you're literally making their job harder because you are just routinely putting stuff out in the air that can float, that can travel for at least 6 to 12 feet, okay? And if you're a teacher who likes to walk around, then that means that you're basically spreading germs, in multiple directions. Now, the idea of a face guard is very interesting. So if you kind of look like I hate to put it this way, a welder with a clear mask that comes down to here, approximately over your face, you're in a much better place, okay? Much better place, and maybe that will help. That's not a bad idea, okay? Many people, certainly in the hospitals, are wearing both masks and little clear face plates, but I think those face plates will do pretty decently because they do stop the spread of physical particles. In fact, probably even more so because the plastic is not very porous. Now, it may make your breathing a little bit more challenged over time, but I think it's definitely a very good consideration for teachers who want to be a bit mobile. But that doesn't mean you can be around the students. We're talking about when you're at the board, and your first student is a good 6 to 12 feet away from you, because you're still going to have droplets coming down. So if you're trying to walk around the room, that's not a good idea. Okay. But if you're going to be at the front, then certainly I think that's a reasonable alternative.
Very good. Some of the other teacher-focused questions that we got over the course of the week leading up to today include conversations about strategies that teachers can use to make this transition back into the classroom more productive for children. After several weeks of online curriculum, after several weeks of this dysregulation that we've been talking about, how do teachers make their students feel safe and normal, but also they're coming back, they're bringing students back into a classroom that isn't normal, that isn't what it was when they left. How do we negotiate that dynamic, do you think?
Well, first of all, the consideration is that there isn't a normalcy that's being returned to.
Mm-hmm.
I think right off the bat, in preparation for the return to school, there needs to be conversations with both parents and teachers and I was going to say in a forum, but we can't do that, in a virtual forum, where there's the discussion that this is not normal. We're all navigating new waters, and this is about helping to protect each other from ourselves and from other people. And we're all going to have to make some changes. One of the things that I wanted to mention about the teacher wearing the face mask or not wearing the face mask, the teacher is a symbol, a role model, and somebody that students look up to in general. If they see that person is not wearing a mask, they ask the question, well, why do I have to wear one if you're not? So there has to be some type of protection just from the sake of what kind of message we're sending to the kids. Okay. That goes to the previous question. What is really important as we transition is that the principals, the teachers, the administrators recognize they have to constantly really be there as models and reinforcers for the kids, but also to share with them that this environment is meant to be protective and not one that's meant to be penalizing. Okay? We're not punishing you here. What we're doing is we're trying to help you be more safe in this new situation and in this new environment. Okay, this is not one of games. It's not one of someone's perspective. We know what the statistics are. We don't want, and in fact, the person who may be an asymptomatic carrier. A child certainly can be an asymptomatic carrier. Take it home to a grandparent or a parent, and then there can be some really negative outcomes. Okay, and I hate to say it, but statistically, it's going to happen. That hurts my heart tremendously. And that's why we talk about as many protective measures as we can to minimize that from happening. Okay, so we talk about education within education. We have to now re-educate ourselves, our children, and our educators in terms of sharing the understanding that this is not a return to normalcy. Normalcy is gone. You can forget it for the next 9 months. What is different is how do we adapt to a new system, to new circumstances? And as human beings, we're tremendously resilient. We really are. If there's a will, we can find a way to get it done. And children of all little beings are highly adaptive when given the right guidance. So if we reassure them, if we give them the opportunity to say, here are the boundaries, here are the rules around these kinds of behaviors, these kinds of interactions, around proper masking etiquette. And look, we've got to do it too as your teachers. All right, we're all in this together. I think that's an important key. We're all in this together. Then the children are going to have a very different attitude, and they're going to feel more calm about it and less anxious from a cognitive perspective. It's not just me, little Johnny's doing, Mary's doing it, Miss Samantha, our principal, is doing it. Everyone is doing it. Our teachers are doing it. We're all in the same boat together. So I think certainly uniformity, a sense of oneness in this effort is important to share with the students. This from a cognitive or an emotional perspective. From a technical perspective, I'm sure teachers would say it's a nightmare. Okay, how do we get this done? I'm used to teaching this way. I don't want to have to use the computer system. I don't want to have to be live on TV or the internet or whatever have you. But those are things we're all going to have to work out over the course of time. Okay, but us keeping calm in this process, understanding that we're not battling a temporary, let's just get through this thing. We really have to reprogram our minds and even perhaps the entire system to how do we navigate these kind of waters? Because we've already seen, coming from China, there's a new viral kid in town who may or may not grow into another pandemic. So what do we do then? Okay, we're getting some interesting messages from the world around us that at any given point in time, there may be changes that are going to require some real adaptation. So instead of, let's say, panicking, let's perhaps take a problem-solving perspective that doesn't involve a punitive nature. Okay, I know our administrators in the state governments and the federal government are coming out with all these wonderful things, and they have no idea these rules and regulations, and they have no idea how the school really operates, or the different school systems that are in play that employ different capacities and different rules and regulations and blessings to help children learn. They're not all going to mesh with these new rules and regulations very easily. So we also have to talk to our parents and our children and our educators about how this is going to be a process of change, and that it's not going to be perfect, not even close, because the parameters keep changing all the time. We're opening, we're reopening. No, we're not opening. No, we're pausing the reopening because things are getting worse as we try to reopen too quickly. Okay, further along, when that vaccine comes, and I don't want to get 1,000 questions on this just yet, but sooner or later there will be a vaccine that actually does what it's supposed to do, that isn't harmful, that will help folks, and then perhaps we can relax around some of these changes and new rules and new regulations that are afoot. But it's one that's going to be a time-honored phenomenon. It is going to be probably school by school because each school has a different set of issues, different personalities, different challenges. And so we really just all got to work together. And we'll talk about this later, but certainly many systems are in play to try to bring educators together to look at problem solving in the future. And we're part of that discourse, correct, Mr. Wells?
Yes, we are.
Bringing that up and looking at that future forward. But for now, there's so much to talk about. We can't do that all within the course of this one conversation. But we're going to be working towards that end, and we're going to be helping school teachers and administrators, even just staying sane. We've got therapists that we're talking about. We've got sources of emotional support as well as physiologic support and even nutritional support to help us optimize our capacities to make it through this time?
Here's a question that's maybe just a little bit more technical, but one that we've actually gotten from a couple of folks that have written into us. And they're asking, is there a way to truly promote social distancing in a school setting? How do we effectively keep kids of all ages, from kindergartners and first graders who, just may not understand, to high school kids that, they live for the social engagement as it is. How do we keep kids, how do we keep young people socially distanced properly in an education setting, or can it be done?
The political ramifications for this are ridiculous. The social ramifications are less of a burden. So I'm just going to be a physician for a change. Good luck on that. Okay. Children are naturally playful. That's how they develop. That's how they grow. One of the most wonderful experiences I've had as a dad, is walking in through the door and getting tackled, by my children. Good luck in telling them you can't do that. Okay, and they don't understand why. Play is integral. Distancing is not how we were created. We're created to be very social beings. So there's a lot of absolute conversation and discussion. It's not going to be easy. I've heard people talking about reduced classroom sizes. I've heard about people talking about maintaining or even alternating classrooms for individuals, one period versus another period. In other words, this small group is here occupying this space at this time. And then ring the bell, this group leaves and another group comes in. There are all sorts of creative ways that are being thought about and may be actionizable. But from a medical perspective, if you are in a room in a confined space and you're not wearing a hazmat, outfit here, complete with a little personal bubble for breathing over your head, then it's going to be extremely hard to make this effective. We're doing the best that we can as a unit, as a body, as a society, to try to help this transition back to school. A good colleague of mine has a daughter who's going back to college. And as I understand it, Mr. Wells, this young lady is going to be on campus, but still confined to online learning, except for labs and research, where she'll be in a very small group that may meet with social distancing in a smaller venue. But 99% of the time, it's going to be still remote learning. Okay, so there are many institutions that are coming up with some very creative avenues, and that's very hopeful. But in the younger classrooms, I think it's going to be a bit of a challenge because many of our children, remember, the prevalence of ADHD, okay, the prevalence of hyperactivity. And when you're talking about preschool, I mean, oh, good golly, Miss Molly, I don't know how you're going to get a preschooler to socially distance. Okay, I don't see that as being a real strong possibility. And I want to make it very clear. I've worked with children ever since I was 13 years of age in an informal setting and then in a formal setting. Between college and med school, I was a preschool teacher. And in that whole setting, for many, many years, I've worked with kids from age 2 to age 18. And I'm saying, as a former part of the educational system type person, good luck on that. That is pretty much just not happening. Okay, so we have to be realistic about what we talk about versus what we actually can do, and have the realistic considerations around what happens if that fails. Okay, so something will be figured out because it has to be, but we're going to have to be very creative around how we actionize that. High school is one thing, college is another school, middle school is another issue, but We're talking about younger kids, that's going to be extremely difficult. Extremely difficult.
Well, you've raised the topic of college. And so we do have a couple of questions that are specific to college, because not only are students going to be in classrooms together, but they're going to be on a campus. So, it's not just their in classroom interaction, but pretty much their entire lives, their entire existence is confined to this large group of people they're going to be interacting on a regular basis. Several schools have started to put out their plans. You mentioned the plans where my daughter will be returning to school, where they're going to be doing a lot. Any class that's more than 25 students, they're going to be doing it online, but they'll have smaller discussion sections so that people can still have that face-to-face interaction. There are several schools that are saying that they're going to start a little bit early and then be finished by Thanksgiving so that students don't go home, get exposed to other germs outside of the closed campus environment, and then bring all of that back to campus. And so, in essence, schools are going to be shutting down after Thanksgiving, or at least moving to remote learning after Thanksgiving. So, your thoughts on some of these plans, some of these processes that are being put in place? You just made an interesting statement. Good luck with that in terms of social distancing. Do you think these colleges and universities are doing these things in a way that's going to make a difference? Or are we just doing things to kind of, again, give us peace of mind about navigating this new normal?
I don't want to minimize the efforts of the school systems here. I genuinely think it's not about peace of mind. The schools are struggling. I have very good friends who are high official administrators at universities, and they have talked to me and said, Albert, this is crazy. They said, trying to navigate the waters of what the professors do and how the students learn and so forth is just, it's been, a madhouse. They are stressed. Folks, there's no one out there from an educational system level who is not stressed out by this. So please don't think they're just trying to placate you or placate the government. They're working hard to try to find answers. The difficulty is that, let's face it, our educational system was based upon social interaction. It was based upon proximity and maximizing that proximity space for educational purposes. So now we're talking about distancing. So we're talking about really breaking down the very nature upon which our educational system was sort of founded, or one of the major premises upon which it was founded. And this is something that is going to be extremely difficult to do. Quite honestly, I'm not as worried about the students going home and catching something and bringing it back to the campus as much as I am the other way around. I'm more concerned about all the students getting together one way or the other, okay, and then taking it home over the holidays. It's not the students as much who are as challenged as much as it is really their parents, their grandparents, maybe their younger siblings, or older adults, once they come home. Because they're coming home for Thanksgiving, they may be hanging around throughout Christmas, or whatever the situation may be, but they're bringing all that stuff back home. They'll be carriers, if nothing else, for the most part. Not everybody, but some will. So I think that's, one of the major issues that we're dealing with here. And, let's face it, our kids at college pretty much don't eat as healthy as you possibly could. So then there's the issue of diet and inflammation and all these other things that come into play that can cause somebody to be more susceptible, okay, at the collegiate level. So, this is one where it's a new world. It's not a new normal, it's a new world. If we do it right, it's a new world. What is necessary? A new world. This is not something that is just passing by, because we've already seen hey, we got this thing, we got hit by this thing, seriously around February, March, where people really taking notice of this at all levels. And it's going to be until next March before we have a real clue as to how the pattern of this virus really moves, which means we've lost pretty much a whole educational year just in terms of learning how this thing is working. So now we don't expect that we're going to have a bulletproof system. We're not. We expect trial, error, failure, but we also expect that we get back up again, working together to resolve, to solve, and then to produce new ideas and new ways of learning. Speaking to one educator who is just retired from the Chicago public school system, brilliant lady. I mean, brilliant. She was nothing less than tops in any class and scored nothing less than 99%, at any standardized test. And she said after some 20 to 30 years in the school system, teaching science, she gave me a history lesson on education. And she said, you know what? Since the industrial age happened, we've had the same basic education system being promoted over and over and over again. She said, it's time for a change. It's been time for a change for a very long time, but we haven't done it. And one of the things this scenario is revealing to us is that we've got to have, I think, several stages of goals. We need to have perhaps the immediate stage of how do we do our best in the short term, but maybe we need to start thinking about shifting how we do what we do educationally for the longer term. Because right now it doesn't look like this is going to be the safest way to go. We've had epidemics in the past, we've had pandemics in the past, and at the rate we're going, who knows what's going to happen. I think we need to have in place a new system that we can really refer to or perhaps just change over into. But right now, the stress is not on building a new system. The stress for all of our teachers, administrators, parents, and principals is on what do we do now, okay? So we need to focus on that level of problem solving, which again requires some patience and flexibility. And we really need to talk to the government administrators as well to kind of say, hey, listen, we all have to be flexible here. There's some things that we can and cannot do unless we're going to stay totally with an online system, working at home with people in isolation. And then are you going to pay for the nannies and the educators to come home and watch the kids while our parents are busy at work because they can't all stay home, okay? We've got to come up with some real appropriate solutions and be understanding in this process. We can't just pontificate this is what needs to be done and then boom, an 85 to 90 page document sent to a principal somewhere all of a sudden has to happen in terms of the new rules being followed within a month's time. That's not realistic, okay? It's stressful.
Absolutely, absolutely. And you started talking about some of this this distance learning and many of the changes that we are seeing in this quick adaptation, but also some changes that we were starting to move towards anyway before the pandemic, is this increased use of blended learning, of having part of your class where offered to you via internet, via digital interaction, that type of thing. More and more college age students especially are taking more and more online classes even when they're living on campus. And so this does seem to be kind of the push to shift to that modality all the more, at least to talk about how we make that modality both work and how we integrate that modality with the more face-to-face educational process.
Absolutely. I mean, let's look at the realities of life. So those of us who remember growing up with something that wasn't called an iPhone, those of us who grew up with something that wasn't called a computer, we had no digital age. Mm-hmm. We grew up and it was mandatory that we had social interaction and presence. We complain about Generation X, the next generation, the millennials, because they're so rooted in their digital devices. But what has that really shown us? It means that they pretty much educate themselves and experience most of life one way or the other through a digital medium. Okay, the next level of children were born basically knowing how to work an iPad and a computer in ways we didn't even know were possible. okay? The challenge is for us in the older generations to sit down and try to understand these kids and how they work and function and learn. And maybe instead of simply having governmental institutions and administrators lay out the law, let's bring some of the students into the mix here. Let's ask them, how could we solve this problem? How do you respond to this way of learning? What is it that you find useful and what is not? What is realistic? Because they are we are the immigrants to the digital age. They are natives to the digital age. Maybe we need to talk to the natives about how this might work better, and then work together to try to figure out what makes sense from a rule and regulation perspective. Okay, I know that's just conversation, but you know, these are some of the thoughts that we have talking to many teachers, talking to many educators, talking to students. Okay, how can we best help create something that works for you instead of telling you what it is we think is going to work for you? They grew up learning very differently than we did. Okay, some of us are very hesitant to even go think about going back to school because it's going to be all digital, okay, and online learning. These kids are not. They're just like, okay, whatever, you know, that's what I do 24 hours a day anyway. I learned this from that, you know, that internet, blah, 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 and this internet piece and that internet piece. Like, where'd you get that? Oh, from such and such website. Okay. So it behooves us now for some of us to perhaps become students and let some of the students become the teachers. And maybe we get a new system put into play. And I'm not kidding. Even at the level of the grammar school or middle school students, they might have some great suggestions about how to help them learn in this new digital age.
I got a question that just came in here that kind of harkens back to one of the first things you talked about. You know, you mentioned the need to have our students tested, you know, 3 weeks before they actually go off to school. And as we were talking about college students and sending our college students back to school, one of our viewers wrote in and asked, you know, if a college student has been tested for COVID, any thoughts on what determines whether or not they have immunity and how long that immunity might last? You know, if they come back and they've tested negative, can we send them off confidently, or do we have to do the antibody test?
Okay. Depending on what kind of test you're talking about, if you're talking about the presence of COVID, you're never secure. It means at that moment you don't have COVID.
Right.
Tomorrow you could have it with exposure. If you're talking about an antibody test, you know, quite honestly, we're not 100% sure about the ramifications of how long immunity lasts with the COVID. It's a new creature. But you can be yet a different degree more confident if antibodies are present. But please understand, antibodies doesn't mean you don't get sick at all. Antibodies don't mean you don't get reinflamed. Antibodies mean you've got capacity to, when that virus rears its ugly head again in your system, you're more primed to quickly respond, much more quickly than when you first encountered it. Okay, so it's not that with a positive antibody test you're all of a sudden invincible. That is not the case at all. But you are certainly better protected. And that's where you get the chance to sort of sit down and say, okay, I still have to be smart about what I do. I may be protected better, but while those germs, those viruses are swimming around in me and encountering my immune system, I'm not wearing a mask, I'm talking to people, I'm eating around people, and guess what? I might make somebody else sick. So it doesn't mean that you are now immune from wearing a mask or a protective device or keeping the presence of other people in mind. Antibodies don't mean that you will not catch the virus and have it in your system. Antibodies mean that you will actually be better protected so that you personally don't get as ill or perhaps suffer some of the major consequences from it. But it doesn't mean that you can't deliver that to somebody else who could die or become seriously ill. And some things that people don't realize, and I want to address this, I've come to the understanding that young people are having antibody parties where they're coming together in party form so they can all expose each other to, you know, this COVID virus. And people, let me tell you, we're not talking about the old days where we're talking about the measles and the mumps, okay? Where back in the 70s, family members or families would get together. When one child had the measles or the mumps, they'd have a little party so that the other kids can get them. You know, the measles and the mumps were temporary items that on average did not cause major illness or major distress, okay? This is a whole different bird. This thing, if you survive it, may carry neurological consequences, may carry consequences for your limbs, your extremities. People have had, surgeries to remove limbs because of the sequela of COVID, even though they've survived COVID. This is no joke. This thing can cause a lot of brain damage in the long term because of anoxia, oxygen that's not getting to the brain and to other parts of the system, okay? To me, that's like saying, well, let's all, when somebody catches fire, let's all catch fire so that we can protect ourselves against catching fire. Wrong idea here. This is not that kind of game to be played. Very, very serious ramifications for this. If somebody's got COVID, you stay away from them. Don't have a party around them. Quite the opposite. Quite the opposite.
Well, it looks like we're coming to the end of the questions that were both sent in before and that have come in today. And thank you to all of our viewers for sending those questions in and for spending time with us. I'm just going to ask one more general question. Somebody sent this in earlier, and I just thought it kind of captures all of the concerns that we've been talking about today, and that was, okay, I'm resigned to the fact that I've got to send my child out into this germy world and go to school. What can I do to protect my child? How can I prepare my child mentally and physically to get back out there for school and for social activities or for work or for anything else for that matter?
Okay. Well, we're always going to start from a medical perspective and from a physiological and biochemical perspective. Gird your child up with the proper dosing of potent nutrients, okay? This creature that we're dealing with is a biochemically destructive creature. COVID works by destroying the biochemistry that relates to the vascular system and to cell physiology and cell capacity for function, okay? This is not a respiratory issue. I know we've thought that for a long time. Wrong. We've been talking about this for months. It's not a respiratory issue directly. It's indirectly affecting hemoglobin, iron, and oxygen capacity. So what do we need to help support that? Vitamin C. Ascorbic acid is the key binder that holds all of this together. So having strong levels of vitamin C will actually keep hemoglobin and iron bound in the system so that you can continue to get oxygen in and to decrease the inflammation that happens in the system. So appropriate levels of vitamin C, appropriate levels of zinc, and appropriate levels of melatonin are all very, very important here in terms of supporting ourselves. I'm talking about adults and even children. And I know we talked about how children have high levels of melatonin. That's fine, but our children are very deficient in zinc because zinc is a multitasking agent. Zinc is necessary for growth, physical growth. It's necessary for emotional functioning. It's important for DNA repair. If you don't have DNA repair, proteins, enzymes, hormones don't get made properly, and your system can't function very well structurally or mentally. Most children are zinc deficient, plain and simple, because they're growing or because they're malnourished. So it's important to have proper levels of zinc. And you know what we don't do? We often don't check vitamin C levels. And somebody out there is going, what? We can check for vitamin C levels? Absolutely. It's done all over the world. We have not routinely checked for vitamin C levels here in the United States. So here's the thing. You want to prepare your child? Here's what I would suggest. Start now with some basic testing. Get your vitamin C levels checked. Get your zinc levels checked. And then, whether they're low or not, take on the right dosing of vitamin C and zinc to promote better stability and better physiologic health so that you can fight the awesome fight against the COVID, okay? You may catch it, you may get sick, you may be out for a few days, but if your immune system is where it's supposed to be and your antioxidants are in place, Maybe the worst thing you'll be able to say is, gosh, I was tired for 2 or 3 days and that was it. We've had a lot of patients say that. So that kind of support for teachers, for educators, for students, everyone really should get tested along those lines. Before that, or at the same time as that, get tested for the COVID. Whatever that looks like, I think every single teacher, parent, and child should get tested, plain and simple. Minimum 3 weeks before school starts. Okay, I don't care if there's a flood of people, heading towards the laboratories. The important thing is knowledge. Okay, and the idea is knowing what your status is before you go in there. Then you can have an opportunity to say, well, listen, I knew I was antibody free, even though there's like a little bit of wiggle room in terms of the accuracy of the test. But you have a very strong capacity to say, I'm pretty sure I didn't have this thing before I entered school or before I got in this circumstance or that circumstance. Okay, so that allows for tracing to work better, and certainly it gives you a little bit more confidence about what's going on here. So everyone should get tested. Everyone should go get their vitamin C and zinc levels checked. Okay, for those of you who are hanging out with us more often, if you haven't had your pyrroles checked recently, go get your pyrroles checked. Contact Direct Health Labs, DHA Labs, at area code 847-222-9546. That's area code 847-222-9546. Get your pyrroles checked, because pyrroles can deplete your system of zinc. They can deplete your system of other aldehyde molecules as well. So if you've got pyrroles, that too has to be treated, because pyrroles are actually a sign of stress intolerance. Okay, that there is inflammation going on, that there is oxidative stress going on. And so you can treat those things as well. I'm not going to talk about the litany of biochemical issues going on here, but those are 3 very, very important pieces. Test for the COVID, test your vitamin C and zinc, test for pyrroles, and then, of course, now do what's necessary to build up your immune system. Treat the pyrroles, bring up your zinc, bring up your vitamin C. For you adults out there, start taking melatonin. 1 milligram per day is what you need. Basic. So the keys here are prevention on that end. Before school starts, talk to your children, parents. Let them know what to expect. No, you're not going to be able to run around and grab Tracy's hair. No, you're not going to be able to push Sam down because, he bothered you. Stuff you did, last year, you cannot do that this year. You're going to have to maintain a bit of a distance from them, a bit of a way, and that's going to be everybody, not just you. Have those conversations. Administrators, talking to your staff, it's going to be rough, okay? But here's what we need to reinforce for the students. We need to do all these other things relative to support and encouragement for our teachers and our educators. And parents, really be gentle with the principals and with the school administrators. They are highly pressured, and they're not just trying to create something, they're trying to do something that works for everybody, okay? So thank them for all they do and for their careful and cautious work. Speaking to you as a parent also, if your child is somebody who's got reactive airway disease or perhaps a much more complicated situation, please consider asking if there's an alternative route to education at that school for your child. There are schools out there that are saying, yes, we're going to open up the schools, but we're still going to have online learning. And it's going to be your decision, and we respect your decision. Some of us are choosing to pursue online learning. I will tell you now, that is what my child is going to be doing for the next 9 months, okay, if I have my druthers, okay? So, and why is that? Because I certainly want to make sure that we've got capacity for safety and to prevent any challenges from happening. My child doesn't like it. My child wants to go back to school and be around their friends, but there's something else that will be figured out in time. But what we're saying is look for the flexibility in the educational process at different schools. We can't speak for every school in this country or in other countries and what they're doing, but we can talk about perhaps some items that we need to look forward to and where the conversations may go. What are our options, dear principal, dear administrator? What are the options that we're working with here? What can and cannot be done? That's the first part of the conversation. And those pieces really need to be had now before schools reopen in another month to 6 weeks or so.
Very good. Well, Dr. Mensah, thank you, and I can share with you that we're getting several comments and chat uh, announcements from our viewers saying thank you for this and how useful it's been. Um, those of you who are watching and recognize how useful this has been, share it. Let folks know that you saw this webinar and that we had some conversations that might be useful for folks. We will be uploading the video replay of this webinar to the Mensah Medical YouTube channel either later this evening or first thing tomorrow. And so you can encourage your friends and family members to go to Mensah Medical, go to YouTube and type in Mensah Medical, and they'll be able to see this webinar, the video replay for this webinar. We also encourage you to follow us on our Facebook page, as well as our Twitter and Instagram feeds, but specifically on our Facebook page, there'll be links to this video replay so that you can access it there as well. We also encourage you to keep your eyes and ears open because we're looking, Dr. Mensah kind of spoke to this a little bit earlier this afternoon, but we are planning to do more sessions as it relates to this whole idea of going back to school. We're going to bring college students in and have conversations with them. We're going to speak to administrators. We're going to speak to parents. And we're going to create some forums where folks have an opportunity to talk to each other even and share some best practices. So those opportunities are on the horizon, and we encourage you to keep your eyes and ears open. Dr. Mensah?
And we're very excited about that. Someone may ask, well, what's a medical institution having to do with the educational system? And the reason we're bringing this up was because we had parents come to us, patients of ours who are parents, and they said, what can we do here? We don't know how to navigate these waters. And so that's what sort of started all of this here. And the idea of bringing together all of the decision makers, the educators, and forums for parents was deeply ingrained really a few weeks ago. And so we're really excited because that gives us opportunity to begin that communication process that we've been talking about. And it is not just limited to being in Illinois. We've got some great administrators, head honchos in Atlanta, therapists from California, folks who are in the East Coast area and in the Midwest, all coming together to have conversations, discussions, and to see if we can problem solve. There'll be forums and discussions for administrators. There'll be forums and discussions for parents. And as Mr. Wells pointed out, the young folks, the collegiates, the teenagers, to talk about where the challenges are and how we can best move through this. And we're hoping to incorporate some therapists in this process as well, to kind of help talk about how we share that burden and not take on a lot more weight than it's really necessary. So please be on the lookout because there's some great stuff on the horizon here. And we're working diligently to try to do this as quickly as possible. We're not going to have answers for you before school starts. But if we're really blessed, maybe we can have some good conversation beginning and work throughout perhaps even the course of the year at different points to kind of discuss how things are moving and what we can do next differently. Okay.
Absolutely. And as you pointed out so eloquently before, Dr. Mensah, I have a lot of hope and confidence and excitement specifically about those sessions that will feature some of our younger people, our college age students, because as you said before, they are digital natives. And I, not to diminish the capacity of old fogies like us to come up with good ideas, but I'm really excited about the ideas and the guidance that's going to come from our young people in having this conversation.
Old fogey, speak for yourself.
And on that note, thank you everyone for joining us. We hope you've enjoyed this conversation. Again, share it with your friends and family members by guiding people to our YouTube and our Facebook page. Next week, we're actually going to be talking about some of the global aspects of the COVID-19 pandemic. We're bringing in actually folks from the royal family in Kuwait, a leader of an international psychologist organization. So again, be on the lookout for information about that. Again, another important conversation as we continue to talk about our dealings with COVID.
Yes, we will have the actual president of the Middle Eastern Psychological Association. A big time honor to work with such a prestigious individual and guest. I had the pleasure of meeting her and talking to her when we were brought to Dubai to discuss biochemical imbalances in the Middle East. So we are greatly honored and really excited, folks. It's going to be a very interesting conversation.
Absolutely, absolutely. And so we look forward to being with you again next week and with those honored guests. And again, be on the lookout for more information about our continued conversation about education during this COVID pandemic. Until then, we'll see you next time. Thanks so much for joining us.
Thank you.